Your voice matters. Residents and families have an important role in medication safety. The Ontario Ministry of Long-Term Care is partnering with the Institute for Safe Medication Practices Canada for 3 years to support long-term care homes in strengthening medication safety. This initiative is called Strengthening Medication Safety in Long-Term Care. This work will include addressing Justice Gillese's specific recommendations with respect to detecting potential medication incidents that would otherwise go unnoticed. Hello, my name is Melissa Sheldrick, and I am the Patient and Family Advisor at ISMP Canada. My role in this important initiative is to ensure that residents and families remain at the center of their medication management system. You are an important part of your health team, and your safety is increased when residents, families, and staff work together. Did you know that mistakes with medications happen sometimes? In this video, you will learn how residents and their caregivers play an important role in the medication safety team. Residents and family caregivers have the right to be shared decision makers in medication management and other important decisions. Making sure your voice is heard is important to your quality of life. This video will help you learn how to make your voice heard so that you can be part of important decisions about your care.
I try to keep informed, and if I get something that I don't recognize in my little cup, I definitely ask questions, because I had an issue at one time where they gave me the wrong medication, and I looked in the cup and I said to the nurse, "What's this?" And she said, "Well, that's what you take." I said, "Oh, no, that's not what I take." And I said to her, "Could you please go to the computer, bring up my name and my picture, and you will see the list of medications I take." And sure enough, she informed me she made a mistake.
Wow, Devora was able to stop a medication error before it happened. You might not know it, but from the time your doctor or nurse practitioner prescribes a medication until it gets into your hands is quite a complicated process. Let's go on a journey from when a prescription is written until the time it reaches you. You'll see that it's complicated and that there are a lot of people working to keep you safe. This will also help you to see that you are an important part of the medication system. When faced with a health challenge, you, your family, and your healthcare team should talk about your health together and the kind of treatments that you want. Discuss what your health goals are with the team and how to best achieve them. You are part of the decision-making team, and your voice matters. Shared decision-making involves people sharing their experience and goals for medication with their health team, who in turn share their knowledge of the specifics of medication and any side effects that may occur to determine the best approach for you. Then, your prescriber can write a medication or treatment order that best reflects what your goals are.
These medications are prescribed to help you maintain your health and quality of life. However, sometimes mistakes can happen with medications, and these mistakes can cause harm if they're not caught. If we know all of the steps that are needed to get a medication to a resident, we can think about the places where a mistake can happen. When your prescriber, usually a nurse practitioner or a doctor, writes a prescription, it is sent to the pharmacy. A pharmacist checks it to make sure it is the correct medication at the correct dosage. They check to see if you're allergic to any of the ingredients, and they check to make sure it won't cause any problems with your current medications. If everything's okay, the pharmacy team fills the prescription and the medication is sent to your long-term care home. Once it gets there, the home staff checks it again to make sure it is the drug ordered by your prescriber. It is then stored in a locked area or drug cart. When it's time for your medication, the nurse will check your medication list and will check the medications packages to ensure they are the correct ones. The nurse will then bring it to you after checking to make sure that you're the person the drugs are intended for. Don't be afraid to ask any questions that come to mind. If you don't understand why you're taking a medication, it's okay to ask. The nurse may not have all the answers, but they can follow up with the prescriber or the pharmacist.
Here are some questions you can ask about a medication. Will I have any side effects? Will this make me sleepy? Do I take this for a short time, or will I be on it forever?
If you notice a change in your medication, ask about it. Maybe you usually get one blue pill, two white ones, and a capsule, but today the blue one is missing. Ask the nurse to recheck your medications, just like Devora did. This is one example of how you are part of your own safety team. You can say, "These pills are not the same color or shape as my normal pills. Can you please check them to make sure they're correct?" Only take the medication after you have confirmed that it is your regular medication. Always talk to your nurse if you are unsure. Never worry about taking up the nurse's time. Your safety is the most important thing. You might think that the nurse brings your medications when you need them and it's not your job to worry about them. It's really important that you and your family members know about your medications. And if you aren't feeling well, it could be because something changed with your medications. Although it's rare, it's important to know that mistakes can happen.
What should you do if you think a mistake has happened with your medication? If you discover a mistake, it is important that you tell someone, like a nurse, a PSW, or someone from your family right away. The staff might not realize that a mistake has actually happened. Sometimes they might think that you're feeling unwell because something is changing within your health. When the staff know that a mistake has happened, the first thing they will do is make sure that you are okay. The nurse will call the doctor or nurse practitioner for instructions. In a serious situation, you might need to go to the hospital. After you've been looked after, it's important for the staff in your home to look into what happened. By understanding how and why the mistake happened, they can make changes to reduce the chance it could happen again.
When a mistake is being investigated, you can ask your care team about what is happening in follow-up to the mistake. The staff may ask you for your thoughts on what happened. Your voice and perspective are important in this process. Residents and families can share what they think happened and ideas to improve safety. The Residents Council in your home can also support you at a time like this. Let's hear from Barry and Devora about their experiences and their relationship with their care team.
I can't stress enough that residents need to know or at least be involved in some way with recognizing their medications, making sure that the timing is correct. And they do make errors. It happens. It's unfortunate. There has to be some method, some means of helping residents determine, even if something is color-coded or designated for a certain purpose, at least to inform the residents.
I would like to be on the committee that decides how they're going to reduce errors so that I can add the resident's voice to that. I find the nursing staff very careful and watchful, and they very seldom give out the wrong medication.
The full-time nurses that know their residents are extremely careful and know exactly what they are doing. I have had opportunities to get to know my doctor. I've become very acquainted with him and he with me. And that rapport, that bond of relationship is critically important for me and for many other residents in long-term care.
Mistakes with medicine can also be reported to www.mederror.ca by you or a family caregiver. ISMP Canada hosts a website that collects information from mistakes with medications. We have a team of healthcare professionals that looks at error reports to understand how they happen and shares learning with care teams in all healthcare settings so that similar problems can be prevented in the future. Sharing information about a mistake that happened to you could help other people stay safe. Have you ever thought of a way to make an improvement in your home? Take a moment to think of one thing that could prevent medication mistakes from happening. It can just be a small thing. Sometimes small ideas are helpful by themselves, and sometimes they lead to bigger ideas. But all ideas help to drive changes and improvements. Share your ideas with a trusted staff member and ask them to think about it too. You can also share your ideas with the Residents' Council. When staff, residents, and families work together, improvements happen.
If you have any questions for us, please feel free to ask them or share your ideas at ltc@ismpcanada.ca.
Thank you for watching. We hope you will play a part in your medication safety.